Good morning, everyone. Good afternoon. We're excited to have all of you here. We're going to get started in about 10 seconds. Want to give a couple of folks an opportunity to join with us this morning, this afternoon, depending on where you're at. All right, why don't we go ahead and get started? I want to say welcome to everyone. My name is Maxine Henry. I'm with the ATTC Network Coordinating Office. And you are here today for a conversation with the 2022 Recovery Innovation Challenge winners. Next slide, please. For your situational awareness, all participants have been muted upon entry, and this session is being recorded. If for any reason you need tech help, please enter tech help into the chat box. During the presentation, and as you hear from all of your presenters, you should have questions for them. Please enter it into the Q&A box, and you'll see that at the bottom center of your Zoom toolbox. Our presenters will do their very best to respond to as many questions as possible during the live events. And for any that don't get questioned, we will send out some follow-up information when we get with our presenters. Next slide, please. As many of you know, we are SAMHSA funded programs, the ATTC and the MHTTC. And so this here is our disclaimer, which will be a part of the slide deck that is provided after the events. Next slide. This is the mission of the TTCs. We were developed to strengthen the specialized behavioral healthcare and primary healthcare workforce that provides prevention, treatment, and recovery support services for substance use disorders and mental illness. The TTC program is comprised of 3 networks: the Addiction Technology Transfer Centers, the Mental Health Technology Transfer Centers, and the Prevention Technology Transfer Centers. We do want to recognize that our networks strive to use affirming, respectful, and recovery-oriented language in all of our activities. These are our values and are essential to our mission. Next slide. As mentioned a moment ago, I am with the ATTC Network Coordinating Office. The Addiction Technology Transfer Center Network is a national multidisciplinary resource for professionals in the addictions treatment and recovery services field. As you can see on the map here, our network is comprised of 10 regional centers, 2 population focus centers, and a network coordinating office. We do invite you to connect with your ATTC to request and receive free training and technical assistance opportunities. And now I'm going to hand it off to our partners at the MHTTC, Jessica Gonzalez. Jessica?
Thank you so much, Maxine. Hello, everyone. Jessica Gonzalez here on behalf of the MHTTC Network. Similar to Maxine, I just want to take a moment to share a little bit about the Mental Health TTC Network. We are a network of 13 centers that provide free resources, training, and technical assistance on mental health promotion, treatment, and recovery. Our main goal is to accelerate the adoption and implementation of mental health-related, evidence-based, and promising practices across the nation. I invite you to take a look at our website, mhttcnetwork.org, and get connected to our centers in addition to accessing our free, readily available products and resources. And now it is truly my pleasure to segue into our official opening remarks and introduce the one and only Dr. Miriam Delphin-Rittman, the Assistant Secretary for Mental Health and Substance Use in the U.S. Department of Health and Human Services and the Administrator of the Substance Abuse and Mental Health Services Administration, also known as SAMHSA. Dr. Delphin-Rittman previously served as Commissioner of the Connecticut Department of Mental Health and Addiction Services and served in this role for 6 years. Through her 20-year career in the behavioral health field, Dr. Delphin-Rittman has extensive experience in the design, evaluation, and administration of mental health, substance use, and prevention services and systems, and has received several awards for advancing policy in these areas. Welcome, Dr. Delphin-Rittman. Thank you so much for being here with us today.
Oh, thank you so much for having me. And I just have to say thank you so much for convening us all to be able to hear from our Recovery and Innovation Challenge, some of our winners, and really looking forward to the conversation. And do have to say, happy Recovery Month. I hope everyone is having a good Recovery Month. There have been just so many wonderful events, we know, across the country. The Office of Recovery team that recently told me that there have been upwards of more than 80 engagements that have been scheduled that the team has participated in related to just celebrating recovery. And that is just awesome. And so again, I'm glad to be able to be here, glad to be able to share just some of the work that SAMHSA is doing related to some of our recovery, areas of recovery across SAMHSA. So next slide. All right. So as you know, last year we launched the Recovery Innovation Challenge. We actually received about 350 applications. So it was wonderful to see just that many submissions come in from peer-run and community-based organizations. There were 10 winners, and these are the winners. So again, big kudos and congratulations to the Recovery Innovation winners, and you'll see them here. Really, truth be told, it was tough to do this judging. I was actually part of the judging team, and all of the applications that came in really speak to just the momentum and just the incredible sort of dedication, passion, commitment, hope, really, that's being instilled across the country from these various programs. But so in many ways, this gathering is very much like a reunion. And again, I want to very much personally congratulate all of the folks who entered, as well as the winners of the Recovery Innovation Challenge. I love seeing also, I just have to say, love seeing all the different places people are calling in from or joining us from. And it really speaks to just the sense of community around recovery. Next slide. So just to share a little bit about some of our work, last week we talked about and launched our first ever recovery report that was based on data from the NSDA, our National Survey on Drug Use and Health. These are some of just a few highlights of the findings from that 2 in 3 adults who ever had a mental health issue consider themselves to be in recovery, or 7 in 10 adults who ever had a substance use problem consider themselves to be in recovery. And so we know that the recovery work is, recovery is real. There are over 60 million Americans across the country in recovery, and the work that we're implementing, and that really many of you are implementing as well, it is often holistic, and we know that there are just a broad range of sort of individual and community ripple effects. Some of the things that we found in our report is that, recovery sort of correlates with such things as insurance coverage, strong sense of spirituality, having social connections, and treatment as well. Next slide. These are some of the other things that we found in the report as well, and do take a look at it. It is available on our website as well. But, for example, those in recovery from substance use or mental health were more likely to have ever been married, or view religious beliefs as important, so have a strong sense of spirituality. Some other findings, and again, you'll see here that those with substance use or in substance use recovery are more likely to, for example, receive government assistance, have lower income, lower education, have received substance use disorder treatment in the past year. And again, this data comes from our National Survey on Drug Use and Health that is a nationwide survey. I see the question. It can be downloaded if you go to the SAMHSA website, and it looks like somebody just put it in. Love the chat. Just put it in the chat as well, so you can get it from that link there. And then you'll see some of the other correlates of mental health recovery. So individuals being older in age or tending to have health insurance, tending to never have had government assistance, higher income. You'll see some of the other correlates there as well. Next slide. So the other thing we wanted to share is that, we also did release our recovery housing, sort of best practices for recovery housing. We released that, I believe it was last week as well. This outlines, actually might be the week before, outlines about 11 standards for providing an overarching framework around recovery housing. And we know housing is so important. We often talk about housing is one of the key sort of pillars of recovery in terms of sort of health, home, purpose, and community. So the home piece is so important. And what this guide does is it outlines different standards for providing safe, recovery-oriented housing, ultimately that ends up, ideally, in some of the studies have shown, enhancing and improving quality of life. Also in April, we released our National Model Standards for Peer Certification. That also is available on our website. That outlines just a range of criteria around peer certification models and peer certification work, and includes, there's a companion guide you'll see on our website as well that does a state-by-state comparison of some of the models and approaches there. And then lastly, this is the report I talked about, the NISDA report that goes over and summarizes just a broad range of recovery indicators. And the title of that report you'll see there is Recoveries from Substance Use and Mental Health Problems Among Adults in the United States. Next slide. So in terms of looking forward, we know that there is much more work to do. It's been a robust and busy month. The Office of Recovery, which celebrated its 1-year anniversary this month, is just in the zone and really steeped in continuing to develop different products along with many other centers and offices within SAMHSA. But just for example, we have the costs and benefits of peer-run crisis respite programs. That also will include a state-by-state analysis. And there's also another report coming out, Financing Peer Recovery Supports, Opportunities to Enhance the Substance Use Disorder Peer Workforce. And so you'll see a number of resources that we have coming out. And then we have a project finally where we're really excited about this one. We started it by doing a technical expert panel and brought folks in from really across the country to have some initial discussion around sort of key sort of competencies and areas of focus that is important to have within substance use treatment. So that should be coming out soon as well. Next slide, please. And so lastly, we have a few more events as we're coming on to the end of Recovery Month, but trying to get, certainly get in these last few events. As you know, on September 30th is the Mobilized Recovery Day of Service. It is not too late to sign up or to find an event. Last I checked, we were up to over 500 organized events across the country. So you can go to the SAMHSA website or even Mobilized Recovery website and search. There are, again, numerous events to be able to take part in. You'll see the link there. And then again, there are additional webinars and that are still happening as we round out the month. So certainly time to participate in those as well. And then we're thrilled, of course, our resource kit. That includes all of this information, and we have our own QR code where you can get all of this information through the recovery site. Next slide, please. So again, just want to say a big congratulations to our Recovery Innovation Challenge winners, and a big thank you to all the work that all of you are doing to advance recovery and wellness in the individuals that you work with. We know recovery is real, recovery is possible. And it is a testament to the work that you all are doing and the courage and hope that the recovery work that you all are part of, that it helps to instill. So again, thank you for joining us and thank you for being with us. And I will now turn the floor back over to
Jessica here.
Jessica. Thank you.
Thank you so much, Dr. Delphin Rittman, for those wonderful remarks. We truly appreciate your support of the Recovery Innovation Challenge, and we thank you for sharing about SAMHSA's efforts in the recovery space. Wow, really, what a great way to kick off today's event, right, everyone? It's my pleasure now to introduce our session moderator for today, Chief of Staff at SAMHSA, Trina Dutta. In her role as Chief of Staff, Trina provides policy and programmatic guidance to the Office of the Assistant Secretary to advance the behavioral health of the nation and support SAMHSA's mission. Prior to her current position, Trina served as a senior advisor to the Office of the Assistant Secretary for over 2 years, where she focused on behavioral health equity, financing, and systems improvements within SAMHSA. Take it away for us, Trina.
Thanks so much, Jessica. And it's so exciting to see everyone here. We're at the tail end of Recovery Month, so happy Recovery Month for everyone who's joining today. Really excited to be able to join you today, and also just so excited to be able to talk a little bit with some of our winners of our Recovery Challenge. As all of you know, I think everyone who's participating is very familiar with the SAMHSA definition of recovery, which was actually pulled together and sort of issued in 2012. And so when we did this challenge last year, that was really kind of 10 years since SAMHSA's definition of recovery had been put forward. And we were really interested to understand sort of in the 10 years since the definition of recovery had been put forward as that process of change that all of you are so familiar with, we wanted to really understand and use this challenge as a way to identify innovation. So how were communities really supporting people around their path of recovery? And we wanted to identify those innovations that were developed by peer-run or community-based organizations where they're really advancing sort of that notion and definition of recovery. So you see here on the screen our 10 winners. As Dr. Delphin Rittman mentioned, we announced this last May, and we had over 350 submissions. So we're really amazed at just the scope and range of what we received across the country. And really what we were trying to do here is we asked the challenge participants to share details around the practices they use to advance recovery, and to really show us and demonstrate how these practices either expanded upon SAMHSA's definition of recovery, or how they help them really overcome challenges in incorporating recovery into their behavioral health systems or the services that they were providing. So through that whole process, we were able to arrive at these 10 winners, but really, I think we saw so many amazing innovations across those 350 submissions. So really, really excited about all that we were able to learn through that process. So today we have 4 of our illustrious winners that have joined us today. So we can go to the next slide. I'm just going to quickly introduce them, and then we're going to get into about half an hour of discussion with them, and then we are going to hopefully have some time for Q&A with all of you. Looks like we have already almost 300 participants, so we definitely want to have some time for Q&A. So Anna Coffey is the Chief Executive Officer of the Women's Home. Laura Yanez is the Executive Director of the Nevada Caring Contacts. Shelley Elswick is co-founder and president, CEO of Voices of Hope. And Tara Sundam is the Executive Director of Hushabye Nursery. And I think I saw in the chat that we actually have at least somebody who was receiving who's connected to receiving services from Hushabye. So it's exciting that we actually have people who are really familiar with these organizations joining. So let's get into a little bit of an opportunity to dialogue with our panelists today. So I wanted to hear a little bit from each of you around how you feel that your organization is really supporting multiple pathways of recovery. I think we all know that recovery is not linear, and there's not sort of one path from A to Z or from here to there. So there's all these, people arrive at recovery and move through their recovery journeys in different ways. So just wanted to hear a little bit briefly from each of you around how you feel your organization kind of supports these many different ways of many pathways around recovery. So we'll start with Anna.
Thank you. It's a joy to be here today. I am the CEO of the Women's Home, and our mission is to build communities that strengthen women and support families as they reclaim their stability. The most important 2 words of that mission is build communities, and that's how we open up pathways for multiple types of recovery. We have a residential treatment program. We have outpatient therapy, case management, and peer support. I know some of my teammates are on the call. Shout out to all the wonderful work that they're doing. We also have aftercare and wraparound services. But again, our most important part is building communities, because we know that we are only going to be in a woman's life for a short period, and that she will need a community of support around her to continue in long-term recovery. So we've built up lots of services. We give women a sacred space and time and tools to recover, and then we sit back and watch them grow. And there's lots of ways that they can do that and engage in the different programming that we offer. We also lean heavily on our community partners. We do not work in a vacuum. We like to draw in as many partners as we can to do their specialized work. And we also have a very holistic view of recovery. So we've developed a model called the Whole Life Model, and it incorporates 6 pillars of recovery that really match well with the social determinants of health. We believe that for a woman to maintain stability and sobriety over her lifetime, that she will need to have good mental health, good physical health. So those are the first 2 pillars. We also believe that she will need to have good support with her financial well-being and with her vocational well-being. And then finally, social and spiritual elements are in the whole life model, because we know that those are really important aspects to a person's recovery as well.
Great. Thank you so much, Anna. Laura, if you don't mind sharing a little bit from your perspective around Nevada Caring Contacts.
Yes, thank you. So Nevada Caring Contacts it's a suicide prevention, postvention program that also does hospital diversion. And it was started by individuals who were suicide attempt survivors themselves, around what they would have wanted during that time or what support would have helped them. And so the program is really person-centered. We take in referrals. Some of our people we contact, and it could be really intense. Like, it could be, please contact this person 2 times a day, 7 days a week. It could be somebody that just needs a check-in in between appointments and things like that. So we really try to meet the person where they're at. The other thing is that once we found that adults needed it, we also know that youth need it as well. So the Caring Contacts program actually offers support throughout the lifespan, with the youngest that we've brought into the program at 9 years old, all the way up through seniors. And we're able to interact with systems of care to connect with those individuals and to find out how we can best support them. We also are open 24 hours a day, so we can actually make those outbound calls at whatever time's most convenient for the person we're reaching out to. And it's kind of just that knowing somebody cares enough to listen and to reach out to you when you're really struggling gives hope and inspiration. And then the last way that we're really helping with Pathways to Recovery is workforce development. One of our goals is to create a strong workforce here in Nevada, that we're still building our peer support. And so we work with our operators on their professional development and what are their goals, even if long-term that's not to work for us. Maybe it's to go and work at a local provider's office, or to be doing some more of those things with other community partners. We really encourage that professional development in our employees, because it goes to that having purpose and having meaning.
Thank you so much, Laura. That was wonderful to hear. And I apologize if I said Nevada. I know it's Nevada, so I know that's a very particular thing for Nevadans. So I want to make sure that I'm pronouncing that properly. So next, maybe we can hear from Tara at Hushabye Nursery.
Couldn't unmute. Sorry. I'm Tara Sundum. I'm the executive director and founder of Hushabye. And we are a center that serves pregnant and parenting families that struggle with substance use. Initially, we were centered to focus on the babies and help babies go through the withdrawal process easier. And what we learned as we went, learned that really for us to help a baby heal and get through a painful withdrawal, we really needed to heal the families. And so when a family finds out that they're pregnant, sometimes that is okay, I got to get well. Sometimes once they meet their baby for the first time, they're ready to go, okay, maybe I can trust somebody to help me. Sometimes it's not until child welfare steps in and their baby is placed in foster care. But wherever that family needs us, whenever in that service period that they are willing to just take one extra step, that's what we're doing. We offer over 50 groups virtually a month, anywhere from car seat safety, safe sleep, your baby's teething. How do you navigate and work with Department of Child Safety? Our families want to know, number one, is their baby going to be okay? What is that withdrawal process going to look like? Number two, are they going to be able to take their baby home? And number three, what does the future look like? And so us really helping them know that Department of Child Safety is got the same goals that they have. Number one, they want their baby to be healthy. DCS does too. They want their baby to be safe. And by golly, that's what a family does. And they want family unification. And so what we've been able to do is bridge that gap of our child welfare, not being the bad guys. It's hard to make that a family understand that, but for them to understand that really they have mutual goals. And what we found is when we're doing that, we've been able to keep families together. We've been able to make it that if a baby is placed out of home, it is just for a period of time. And we're getting families to build on the recovery so that it is safe. We also have a 12-bed nursery here in Phoenix where our little ones go through that withdrawal process. Quiet, dark environment with one-to-one caregivers, doing it the way that all of you would want your baby or grandbaby, niece or nephew to be cared for. We have everyone that works at Hushabye wants to work with this population. And if that is just with the babies, they understand that really to treat the babies, it's the entire family system. We do use peer supports. We have moms that have been through our program that now work for us. We have a daddy that started about a year ago. We initially gave him 12 dads to work with, and he works with over 100. We had no idea when we started Hushabye that daddy would be part of our program. And it's crazy to see families heal every single day. And our babies initially are just little firecrackers, and the families go, okay, I'm ready to go. So.
Thank you so much, Tara. And Shelley, if you don't mind sharing from your perspective of Voices of Hope.
Sure, thank you for having me. Voices of Hope is a recovery community organization, and we deliver direct services to people who use drugs or use drugs through a recovery community center, a mobile unit that we have that goes out into the community, as well as by placing peers into partner sites across the state. I think the way that we support multiple pathways, we talk about SAMHSA's definition of recovery a lot. It means a lot to me personally. My definition of recovery used to be sobriety, used to be total non-use of anything, and that is further stigmatizing of people who use drugs, and really the language that we're all working toward trying to use. So I think the way that we employ people, we have 90 staff people right now, and we don't drug test when people are coming in. We expect them to be excellent because they are people in recovery, and by recovery I mean they're improving their health and their lives and moving toward independence. They're excellent employees, so it's enough to make sure that they are doing well with their job and what they should be. I think when we look at our mobile unit, a lot of that is about harm reduction, which is a really important pathway for us. We love our traditional 12-step pathways. We have meetings for 12-step. We have medication anonymous meetings. We have all recovery meetings, crystal meth meetings. So we really want to be something where everyone can see themselves in our organization somewhere and know that they're supported directly, no matter what their pathway of recovery is.
Thanks so much, Shelley. So it's really amazing to hear all four of you just a little bit about these multiple pathways to recovery. And I think there's clearly a couple of themes. I think meeting the person where they're at is probably the one that I heard kind of most significantly across all four of what you're able to share. So just wanted to ask another question that I think there's a lot of interest in. How do we know that, you know, recovery support services work, and that, you know, recovery is a real thing? You know, I think there's a lot of discussion around that, and, you know, I think that's why it was so important that SAMHSA, you know, worked to define that, and it's great to hear that that definition is meaningful to your work. So can you each share just a little bit about how you know that the work that you're doing is having an impact on the communities that you serve and the people that walk into your doors? Maybe we can start with Laura on that one.
Sure. So as far as knowing that that our program works, obviously the numbers help to look at it. We've currently, in the past year that we've had the program, have had about 280 people in the program, and we have a pretty good engagement rate. And those are people that have been referred into the program from, it could be a mental health provider, it could be a physical health provider, it could be a school counselor, and they're referred into the program. I think the biggest outcome is that we know it's saving lives, because we are seeing that people that are engaged in the program are not making suicide attempts. Out of the 280, we've had 4 attempts that have all been interrupted attempts where people are still alive. Also hearing from what the participants themselves have to say about the program. Do they find it beneficial? And really responding to that. One thing is, we thought our program should be 30 days when we started, and discovered that for adults, it's normally about 3 months, and for youth, it's about 6 months to actually get the support. So taking in what we're hearing, what we're seeing on the numbers, and then being able to put that into practice to enhance the program and continually moving it forward. I think our partnerships with the community is also another benchmark, because part of our program is now we're talking about the mental health crisis that can happen, and that with support, you can move into more stability. And it's bringing a dialogue to members of our community that maybe weren't comfortable with the word suicide before, or didn't know how people recovered from that or came back from that, or that it was okay to talk about. So I think those are the ways we really look for it, to see that we're being successful. And then listening to our employees and what they think about the program as well, and giving them collaborative decision making in determining what direction the program needs to go.
Great, thanks, Laura. So it sounds like you guys are really able to take in a lot of inputs in different ways to sort of collect information. And it's great to hear that you're able to pivot and think about what's the information we understand about our program, and how do we improve upon it. So that's really helpful to hear. Tara, if you don't mind sharing a little bit about how you guys know what you're doing is having a positive impact.
Yeah, I would say our data, when you look at the national average for a baby withdrawing in the hospital from being exposed to an opiate while prenatally is 21, 22 days, and our average length of stay is 8. When you look at that and you look at family unification of almost 80% of our families taking their babies home, seeing babies get reunified if they get placed into foster, and nothing better than being on one of our groups and a parent having their baby there for the first time with them. I think that definitely speaks volumes. Our growing pipeline, earlier this year, we were working with about 60 pregnant women, went to about 87, but that was as good as we were getting. We're working with over 120 pregnant women right now. And so what that shows is the community is starting to trust us, but families are starting to trust us even more. And then I think, the biggest kudos for any of us would be when you get a referral from another family that's been working with us. Having the family that's on here today, I'm like, okay, who is that? That's just, the ultimate, I guess, dream. and saying that, yay, we work. We do have 5-star Google reviews, which we look at those. I didn't look at them before, but now, by golly, I actually do. They tell us what they need. And then, you know, asking our employees, are you happy at work? If you're happy and you like where you work, all of our employees buy into our mission. They wouldn't come and even apply to work at Hushabye, but are they happy? And as a growing organization, will be 3 years in November. That's one of those things that everyone works towards. And so knowing that our employees want to be here, and when they're bringing their friends in is a big thing. And then lastly, I would say really seeing our families become peer supports, and then them either working for us or working in the community and referring to us. We know it's working that way.
Great, thanks so much, Sharon. So it sounds like you have a mix of both sort of quantitative data that you're able to track, and then also a host of qualitative data that helps kind of reinforce, you know, what's working, and then again, how to continue to grow your program. So that's wonderful. Anna, do you mind sharing a little bit from the women's home?
Sure. Well, we also have both quantitative and qualitative metrics that we use. Of course, there's the quantitative, which we all probably use the same thing. We like to see women graduate from our program with stability in housing, stability in income source, mental stability, and sobriety. So that's what we look at as they're exiting the program. However, as I said earlier, our mission really is to build communities, and so we look at the engagement that women continue to have with us after they've left, and we look at you know, whether or not they're able to have the lives that they aspire to. As I said earlier, we give people the tools and the space and the atmosphere where they can do their work, but then it's up to them. And once they leave us, if they're able to have lives that they aspire to, that is really considered, you know, a wonderful success for us. And I want to use someone who just surprised me by being on the line today as an example. Maggie is joining us today, and she is a graduate of our program. Maggie, I won't tell too much of her story because I don't have permission to share it, but I will just say Maggie is thriving today, has a new relationship with her family, and is doing some amazing work as an advocate in Austin. And she's been you know, working on this life that she aspired to for 6.5 years now, after she left us, but she still continues to engage and be involved and be a support to women who are at a different point in the journey. That's how we measure our success, is by, you know, the women who continue to engage with us. Are they having the lives that they aspire to, and are they able to pass it on? That's what we look for.
Great, thank you so much, Anna. So again, hearing some themes around how, like, getting feedback from the communities that we're in, and how, you know, really that's kind of the focus. And I think always thinking about recovery as not a destination, but a journey, and how are you all, like, using that frame to understand what's working. Shelley, if you don't mind sharing, and then we'll have, I think, one more question, and then we'll go to the Q&A.
Sure. So we use Recovery Capital to help us define how we're doing serving our participants. And Recovery Capital is everything that's intrinsic or extrinsic that can help support your recovery. So we use the BARC-10, which is the Brief Assessment of Recovery Capital Scale. And then we partner with a university to help us figure out what our results mean. So we do know that we have a statistically significant increase in recovery capital for participants who are engaging in peer services. So I think that's one way. Also, like Anna, we do a lot with stories. Every week, we have our recovery coaches send in a story, either of a barrier or a success. Not only are we able to see where the needs are, but also just to see that this is working. And it's really encouraging, and especially in a space where it's so easy to be burnt out. Gosh, the problems just keep coming and coming, but the wins are there too. So I love the stories, and we've just created a story bank, so we have a place to keep all of those. I think the other way that we know that our services are working, we have been part of the Healing Community Study grant. It's a National Institute of Health funded study. And because of our work with coaches placed in the criminal legal system across the state, we're now beginning to develop partnerships like with the Department of Corrections, so that we have peers in prisons. So we're starting to see a hospital association just reached out. We're starting to see where some of the past successes are leading people to say, hey, wait, we deal with people with substance use disorders as well, and how could a peer help us in our situation? Thanks.
Thank you so much, Shelley. Again, I think we heard earlier, and again, you're bringing up the importance of peers and the role that peers have in much of the work that we do. So we have about 8 minutes left before, and we do want to have a little bit of time to engage with some of the questions that have been coming in the Q&A. So I think the last question, and maybe folks can just each take about 2 minutes, is, where do you see your organization in 5 years? Where, where if you got a lottery check for $1 million, or however much it would be, like where would you really want to see your organization go, and particularly in areas of growth, or in that kind of trajectory. So if we can just spend a little time understanding where you think sort of that pathway is for you all, it would be wonderful to hear that. So we'll start with Tara.
Yeah, I had to ponder this. We just did our strategic planning, trying to figure out what we're going to do. 5 years, we're like, maybe that's going to start to do. So we did 3. And when we really look at it, our census for our nursery is hitting capacity more often than it had. And so I think sooner than later, we will have a second location here in Arizona. Maybe we'll have a location that's out of the Phoenix area-ish, maybe up north or down south. There's definitely that need. And really my goal would be for Hushabye is that everyone knows that, oh, contact Hushabye if they have someone in need. And everyone, things like this, if you have a family member or a friend that's struggling and they're pregnant or parenting, that they would know, just call our number, look on our website and get connected. That would be our ultimate goal.
Great. Thank you, Tara. Anna.
We have some bold, hairy objectives and goals. We are going to be opening an IOP within the next year so that we can provide more access to more women with our quality programming. We are also developing a whole building and program around workforce development, specifically for women with co-occurring mental health conditions and substance use disorders. And we are working really hard to meet the qualifications to become a CCBHC sometime in the next 2 years. So really excited about those possibilities.
That's amazing. And yeah, I think I think being bold is the only way to go in this work, right? So those are all wonderful goals for you to move forward with. Laura.
I think a lot of our goals center around reaching out to communities that are underserved or that we haven't been able to reach before. For example, with our teen text line, if a youth doesn't have a phone, they can't text in. So partnering with school districts and creating a chat feature for it, as well as partnering with law enforcement so that when individuals with mental illness do have contact with someone with law enforcement, they're getting a peer follow-up support call. to see if there are any other supports in the community that they need. Do they need somebody to check in with them? And although our program does do statewide, our specific NAMI affiliate is primarily focused in the rurals. So a lot of our goals have to do with really increasing utilization of the Nevada Warm Line and Teen Text Line, which are part of the Caring Contacts program, to those communities that, for example, may have to wait 6 months to get into a psychiatric appointment or a therapist, or drive 4 hours to get to a hospital. Like, how do we reach those communities more and create more of a sense of safety that we're okay to reach out to? We definitely have seen those numbers go up, especially in the rurals, but that is a very underserved area in Nevada.
Thanks so much, Laura. And Shelley, I think you're the last person to go to talk a little bit about where you see yourselves going.
I hope in 5 years that we are continuing to work with the University of Kentucky on research and creating programs that are evidence-based. And I would love to see us able to offer training for others in that area across the state, a real how-to for making some of these programs that are based on strengths and not based on punishment. So I think the other thing is more advocacy. We have been growing so fast, we haven't had time or energy really to put toward advocacy, and I'd really like to be doing more education with our leaders around the state as well. Thanks.
Thanks for that, Shelley. So looks like we have time for a couple questions from the Q&A, and one that I saw that came up that I think is always a really big issue and is one of the 4 sort of elements of recovery is home. And so interested to hear if and whoever is interested in answering, you can just unmute and speak, but particularly how does your organization support people who have housing challenges, who might be underhoused or unhoused, and what does that work mean in the context of kind of your overall model that you're working towards?
Yeah, I'll go first with that. Families can't get well if they don't have a safe place to be. And so we really work closely with our community partners. That's their specialty. It's like, okay, connect them there. But the biggie with us is it's not just here's the application, fill it out, because our families aren't going to fill it out. It's sit with them, fill it out, help them make the follow-up phone calls, be that person that I always say this, I'm like, do it for them initially. I understand that we can't do it for them, but initially we need to give them just a little win, a little W. And as they get more and more little wins, they get that great big win. And sometimes that big win is having safe, stable housing. But that's probably with food insecurity, even though I think that shouldn't be an issue. It is still an issue here in Arizona, but that's like our second in line. You have a safe place to be. And if you don't, working with that, I really try to point our families towards residential treatment. We have great community programs here that have really good outcomes. And so if they're open to that, you get them well. If they're not, let's get them housing and see if we can get them well from there.
Thanks.
So I can add to that. We at the Women's Home, we recognized the connection between housing and stability probably 15 years ago. And we have been building permanent supportive housing that anyone who wants to live in recovery can be a part of. It's not recovery housing as such because it's permanent in nature, but we are building communities, including housing for people who want to live in a recovering atmosphere. And so far we have 171 units of affordable housing. And our treatment program includes transitional housing for up to 18 months. So we're very well aware of the need for housing, and we're working on incorporating housing into everything that we do.
Thanks, Anna. And Shelley, I see you came off mute.
Yeah, I think in the substance use world, a lot of times you have to earn your right to have services, earn your right for housing. There aren't a lot of places that offer housing where you don't have to be abstinent in order to qualify for housing. I think that's a big problem. I think that a really cool thing that happened with the Healing Community Study was that they provided a barrier relief fund so that we could actually help people with housing, even when they're not abstinent, even when they're just beginning on medication, even when they are thinking about moving forward, and being able to actually pay for a month's rent, and not just be the connector to sending them somewhere else, only to hit that barrier of them saying, oh, we've already used our funds for this year. So I haven't seen a lot of grants that would support people directly that way, but I sure would like that.
Thanks, Shelley. So one other question that I saw in the chat was about sort of access and outreach. So just because you build it doesn't mean they will come. And it sounds like all of you have a sort of a queue potentially of people who are seeking your services. But how do you? I'm interested to understand how each of you go about sort of engaging. It sounds like you have a lot of community partners, but outreach, and particularly when it comes to sort of folks who might not be as familiar with the work that you do. If we think about people from different cultural groups, or people who might have kind of English is their second language. So I'm just a little bit about sort of the outreach and engagement that you do in your communities to let people know that your services are available.
And
Go ahead.
go ahead and go on this one. The biggest thing that we found that is helpful is to go out and be present in the communities, not just to show up once for a presentation about, hey, this is what we're doing, but to come back to those communities and to listen to what their needs are. And kind of like I was talking about before, being able to take in that information and pivot a little bit to make the services more meet that community. And so we do a lot of presentations, we do a lot of community events, but we try to be very careful not to take a salesperson approach of, this is such a great service, you should try it, but more just being a person that's there to listen and to validate and to share options so that people have information about what their choices are and can make an informed decision.
Thank you for that, Laura. Shelley, please go ahead.
Yeah, I like the way you said that, Trina, because it's exactly what happened to us. We did build it. We have two other co-founders. My son is one who's a person in recovery, and then our friend who is a researcher in substance abuse is another, and they all look like me, and all the people who came look just like us. Socioeconomically, physically, culturally, very much the same. And so we hired a coach, and for about 2 years, we've been receiving support, personal coaching sessions, and then org-wide sessions to help us learn not how to do it, but how to engage people to ask questions. So we have listening sessions with groups, and we say, what makes you feel comfortable in here? And we've had people tell us, like, quotes you have on the wall are all white people quotes. So how about some quotes from some other races? How about other ethnicities? And so that has really launched us on an eye-opening journey of transformation personally, which I think is different than just looking to do things differently within the org. And so now we really are kind of intrinsically thinking about, how does this affect other people? How many people do we have on a panel that looks this way? We're in process, but I think we're making great strides.
Thanks for that, Shelley. And I love that. I mean, I think the personal is professional, right? So I think that's kind of what you're talking about there, really, I think very eloquently. Anna, I see you came off mute.
Yeah, so I would just say the approach that we've used is to really make sure that we have a diversified workforce that come from every walk of life, so that no matter who you are, you will see someone who looks like you or sounds like you or has the same background as you. And then the other thing that we're doing is a lot of work with our board to diversify our board and what they look like and how they think.
Great, thank you.
I
Tara,
would,
yeah.
yeah, I was gonna say, I would just add that we're not that good. We are working at diversity. It is not easy. It's not simple. It seems like our clients, we're getting there. But as far as our workforce, we're not as diverse as where we need to be, and we're working at that. For those that are on the line, I will tell you, we built it and not everyone came. We're up for 3 years now, open for 3 years, but that has been blood, sweat, and tears of begging, partners and building the community, sharing our data. That has been the biggest thing, making sure that families know, please tell someone if you see someone what we're doing. It's not just easy. Yeah, we're doing really, really well. We've served almost 600 babies in 3 years. We're doing really well. But it was not simple. Start small, get some really good community partners, and then build off of that. We have mommy recommended lists of obstetricians, of pediatricians, of housing. If they had a good experience, okay, let's send them that way. Bits and pieces.
Great, thanks for that, Tara. And yeah, it is hard, right? If it was easy, then it wouldn't, then we wouldn't be having these types of discussions around how to engage folks, particularly when we're thinking about kind of folks from different cultural backgrounds. So I do want to just do a time check. We have a few minutes left. So I think maybe we have time for just maybe a last opportunity to hear from the four of you. If there was sort of 1 or 2 words you could use to characterize sort of the journey that you've been on so far. We all heard where you want to go in 5 years, but it'd be lovely to just hear and I know 1 or 2 words is a challenging question, but and that I think will bring us to time, and then I'll turn it back to our host for today. So I think if we can start with Laura. Sorry to put you on the spot, Laura, as the first person, but
I think that this has been a learning journey for me, and I've learned from the participants of the program, from my staff that I work with, and just by observing. So I think it's just been a learning and a personal growth journey.
Thanks, Laura. Anna.
Go big or go home.
I love that. I feel like each of you are going to have little bumper stickers that we can do from this. Tara.
It's a roller coaster.
And Shelley.
I would say bottom up. People know what they need. Staff know what their participants need. Employees know what they need from us to be supported. Not a good bumper sticker.
Well, I want to thank you so much to 4 of you and to all 10 of our winners. But again, just getting to spend the time with you today and hear a little bit more about the amazing work that you do has been really gratifying. And I do think that the hosts for today are going to be able to send a little video that we have that does a quick orientation to all 10 of the winners, and all 4 of your programs are obviously highlighted there as well. So I think I'm going to turn it back over to the host now. Thank you so much to everyone who joined today.
Thank you so much, Trina. If we can just get the final next step slide up on the screen here for our audience. A reminder that this event was brought to you by the Addiction TTC Network and the Mental Health TTC Network in collaboration with SAMHSA. Please visit our websites to gain access to hundreds of free resources and training for the addiction and mental health workforce, spanning promotion, treatment, and recovery. We're funded through SAMHSA to provide this session, and as part of receiving this funding, we're also required to submit data related to the quality of this event. So we kindly ask you to take a moment to complete a brief survey about today's session. It really only takes 2 or 3 minutes, and we look forward to your feedback. You'll be automatically redirected to the survey when you log out of this webinar. Also, many of you have asked for today's slides, have asked for a recording to share with those who couldn't make it to the live event today. So please know that within 24 hours, we will have the slides and the recording sent directly to you via email. You'll also receive instructions for downloading a certificate of attendance if you wish, and responses to some of the questions that we didn't get to respond to today will also be shared. To close, thank you to our panelists for all they've shared with us today, to Trina Dutta for moderating this amazing session, to Dr. Delphin Rittman for her lovely opening remarks, and to SAMHSA for leading the Recovery Innovation Challenge and allowing us the opportunity to showcase the work of the Recovery Innovation Challenge winners today. And thank you to everyone in our audience for the time spent here with us, learning more about the Recovery Innovation Challenge and our efforts in recovery. Special shout out to those doing the work on the ground to move forward recovery efforts across the country. That's it for today, everyone. Thank you so much for joining us, and take care.